You brush your teeth twice a day. You use mouthwash. You chew mint gum. And the bad breath will not go away. You know why? Because the problem is not your teeth.
See those white chunks on the tonsils? That is not food, not pus, not thrush. Those are tonsilloliths.
Here is what they are made of: food debris, dead mucosal cells, bacteria, millions of bacteria. All of this gets compressed in the tonsil crypts, small pockets.
And the bacteria inside release hydrogen sulfide, the same gas that smells like rotten eggs.
No toothbrush can reach your tonsils. No mouthwash can flush stones out of the crypts. You can brush your teeth 10 times a day, the smell stays. But there is a way out, and it is simpler than you think.
Palatine tonsils are two masses of lymphoid tissue in the throat. Their surface is not smooth. It is covered with crypts, folds, and pockets. In some people, the crypts are deep and wide. Food, mucus, and dead cells all get trapped inside, creating the perfect environment for stones. The bacteria in the stones are anaerobes. They live without oxygen and feed on protein. The byproduct of their activity is volatile sulfur compounds, hydrogen sulfide, and methylmercaptan. These are the same gases added to natural gas for the smell. One small stone can ruin your breath for the entire day. According to research, tonsilloliths occur in approximately 10% of the population, but many do not even know they have them. Stones can be tiny, the size of a grain. You cannot see them, you cannot feel them, but the people around you can smell them. At risk, people with deep tonsil crypts, that is genetics, people with chronic tonsillitis, people with post-nasal drip, when mucus from the nose drains into the throat, and people who eat a lot of dairy products. Casein from milk increases mucus production. First rule, never dig into your tonsils with your fingers, cotton swabs, toothpicks, or anything else. Tonsils are living tissue with a rich blood supply. One clumsy move can cause bleeding, infection, or swelling. I have seen many patients with painful abscesses after self-removal attempts. Do not do it. Now here are 5 safe methods I recommend to my patients. Method 1. Salt water gargle. Half a teaspoon of salt in a glass of warm water. Gargle for 30 seconds, 3 times a day. Salt loosens the stones, reduces tonsil swelling, and flushes out small particles. This will not remove a large stone, but it will stop new ones from forming. Method 2. A water flosser on minimum pressure. Aim the water stream at the crypt where you see the stone. Gently, do not push. The stone will flush out on its own. Important, maximum pressure can damage the tissue. Minimum only, and never use this on an inflamed or painful tonsil. Method 3. Controlled cough. Tense your throat and cough with your mouth wide open. The vibration sometimes knocks stones out of the crypts. This is the simplest and safest method. Do it over a sink. Stones actually fly out. Method 4. Oral probiotics. Streptococcus salivarius K12 is a probiotic that colonizes the oral cavity and competes with the bacteria that cause stones. Dissolving lozenges before bed can make a huge difference. After 1 month, you will see noticeably fewer stones and significantly fresher breath. Method 5. Reduce dairy products. Casein in milk stimulates thick mucus production. More mucus means more material for stones to form. Try 2 weeks without milk, cheese, and yogurt. If you get fewer stones, you found your trigger. If stones keep coming back despite all measures, there are medical solutions. Laser cryptolysis. The doctor seals the crypts so nothing gets trapped anymore. 15 minutes, local anesthesia, no pain, or tonsillectomy, complete removal of the tonsils. This is a last resort, but it solves the problem permanently. Total: salt water, water flosser, cough, probiotics, reduced dairy. And if nothing works, laser or removal. But for 80% of people, the first 5 steps are enough. But 80% of people with tonsil stones make one mistake every morning. They do it on autopilot, and this mistake doubles the speed of new stone formation. Hint: it has to do with how you brush your teeth, not what you use, but how. A small detail that changes everything.